Hi everyone, welcome. Let me double check as I usually do with the iPad so I can follow along and answer questions if you have any, and we can get going with today's live. I'm excited for today because it is definitely a question that I get quite often from you when I probably have told you this, but when I put the call out asking for suggestions as to what topics to cover like through blog posts and here, I got a few that expressed interest in working in teams, and therefore why we have had a couple of weeks that kind of cover the topic of working in teams. I can see if anyone is here. So if you have any questions, let me know. It is going to be a good one, and I know some of you will be highly interested in this. So today we are talking about working or moving through data analysis when working in teams. I have to share with you that I almost didn't make it in time today because I was waiting. It's part of life. Like I know sometimes like things look really composed when I show up at 10. So I wanted to share this just so you know, because it is part of humanity of doing things. So today we had to collect, because it's like a team effort, a pee sample from my almost 3-year-old who is still wearing diapers, as a result, partially from the constant collection of pee samples. And I let her watch the tablet standing up, give her milk, apple juice, and everything that can make the process move a bit faster. But she's smart. And she was like dancing, standing and dancing, holding for as long as she could, because she knew that as soon as we were done, it would probably mean the end of her screen time. So today I let her watch shows for a lot longer because I don't want her to keep doing that in the future. But anyway, pee was collected successfully and was driven to the hospital as fast as we can inside a mug that we usually use for our beverages, but just because we had to keep it warm. So there you go. That was the beginning of my Wednesday. And I see I have a couple of people here. So you just heard about my morning collecting urine samples. One urine sample from an almost 3-year-old girl. That's like part of life, right? So let's get going with our discussion about moving through qualitative data analysis in teams. I think one of the things that I really want to emphasize with all of you who are either part of a team or leading a team that needs to analyze data is that most people struggle with that part of qualitative research because of the responsibility that comes with it. And you're naming things, you're putting words and naming thoughts that someone shared with you, and you're going to put them out there. So I say there is always a lot of responsibility with that, and it is because there is, and that can be really heavy and hard to understand and name for people who are doing qualitative data analysis, especially if they are new to it. So what is the result? What happens? I think that the biggest fear and the most common thing that I see happening is the fear of getting it wrong, which in my opinion is natural, especially if we are trying to do things right, if we want to do it ethically. But at the same time, certainty and that right or wrong is something that is really hard to grasp and nail in qualitative research because there is an element of subjectivity that you really can't remove. And that's why we talk about rigor within the context of the subjectivity that exists in any qualitative research that is investigating human experience and conducted by humans. So there is a level of subjectivity that you as a team member or as a leader need to be comfortable with, but beyond that, communicate and address with those who are working with you. So last year, I had one of the members of QRB, when we had a coaching call, she asked me about that because she works with healthcare providers who are supporting her qualitative projects off the side of their desks. Yet they are very involved, very engaged, and very interested. And she asked me, like, how do I work with these people? Like, understanding that they have a role, like they are in clinics, they see patients, they see my participants, and they are wearing another hat that is not an academic or a research hat. And they value the research, but it's not the main priority for them. So the strategies that I shared on the blog post yesterday are related to that question. I'm not saying that any of them will be perfect, and I'm not sure if they will even work for you, but those are the things that I have tried and that I have seen some level of success in different areas and in different settings. And of course, depending on the timing, who you're working with, everything else that is happening in that setting as well. The first thing that I mentioned is one strategy that I use with the contractors and the students that I mentor through Qualitative. And we usually select one or two transcripts and we code together. If you're doing content analysis, you would follow the steps of coding according to content analysis. If it's thematic analysis, you would following the steps and finding the themes there. It is very interesting to do that exercise for a couple of reasons. Usually what ends up happening, we code separately. In the past, we sometimes would sit together. I did that with a long time ago with a coworker, and we would sit at a coffee shop and do at the same time, but separately. But the most common process for me, especially ever since COVID started, is to just do it at our own time, like separately, and then we come together and we walk through our transcript. We discuss things that we found in certain, for each question, what caught our eyes, and we, for certain sections of the transcript, we kind of look side by side, like how did you name this, like how did you code this, or how did you theme this section of the transcript or this certain paragraph. And it's very interesting for two reasons. It helps them to understand subjectivity. It helps me to understand my subjectivity and where my lens is going. But it also helps both of us to understand where we are going with our data and how to capture the essence, those meanings that are there connected to our research questions. And perhaps they won't be connected to our research questions, and that's another story, but we do have a chance to have that discussion right there. And it's a really rich opportunity. We usually set aside 1 to 1.5 hours, and we do that. So if you are leading a team, I would highly encourage you to do that with your students, with your research assistants, with your group of healthcare providers or anyone that is involved and has a stake at your project. So that's one of the strategies. Now, I also understand that there is the simple fact that for some, even doing that first step of looking at things might be too much. You might need to give them a bit of a background, some teaching about qualitative data analysis. So there are a few papers, like I shared one last week that Kasia, who is one of the students that I'm currently working with, shared with me. It's a good one. The 3 approaches to qualitative content analysis, the QualiQ guide to content analysis might be references you want to share with them. The content analysis guide that I have is under resources on our website. It's free. You can always share with anyone you feel might need a bit more guidance to begin with. And after that, there is also an additional step, and I always say that it depends on how much involvement you want to have and how invested you are in seeing that project move forward. It might be that you actually take the time at starting a code book and you really take that first step and you try to support people and give them a bit of a map, or at least, the guiding points that they can start to think about when they are looking at transcripts. And with that, there is the important element of taking opportunities to explain whether you're using an inductive or deductive approach. One of the things that I have found is that people who have less experience and people who are using a semi-structured interview guide, they tend to really move too fast and go towards a more deductive approach where the questions and the themes in their interview guide become their main categories if they're using content analysis, or their main themes. What I always caution students and trainees is not to miss the novel, not to miss nuances that might be in the data that they are not catching because they are too attached to what their questions were. Because if they are doing that, they are not being really inductive and open to exploration and to what the data is saying. So that's one thing that is important for you to highlight, and try to support people in understanding what inductive versus deductive means. I have a blog post about that. I have a YouTube video where I walk through the buttons exercise. It's also something that I do inside Qualitative Data Analysis Masterclass. So you have a few resources at your hands, both free and a program that you could potentially share with people that are struggling with qualitative data analysis. Now, finally, we get to another piece that is super important. Encourage people to separate or to put quotes that speak volumes about the data in a separate file, or if you're doing things manually, like cut them out and glue them somewhere. Whatever the strategy is, the bottom line is to keep them somewhere and consider using them later on when you're writing. And again, you do need to explain that just putting quotes together doesn't make for qualitative writing, but they will help. And sometimes quotes, I mentioned this in the blog, and I truly believe that quotes can be very inspiring, because especially if you are a practitioner, when you see your clients speaking about something maybe related to the practice, related to their lives, it does have like that tugging, that pulling and recognizing. It's humbling, in my opinion. I think quotes can be really humbling. They can really allow you to have that picture of your participants' lives, and they are powerful in general. So keep the quotes, encourage them to keep quotes aside, and have a discussion about quotes that came up that were really interesting. So with that, we have covered some key elements of working in teams. And if you think about what I shared today and what I shared last week, you could see how those two blog posts and this 2 times that we are together, how they complement one another. So think about, with all the things that I shared today, what else from last week in terms of implementation strategies, management of teamwork, what can you use, what can you implement in order to help your team or lead your team in moving your qualitative research projects along with more confidence, less delays, or more timely, and also with ethics and joy. I think I remember Maria saying, "Oh, I'm jealous of you. Like, I haven't done data analysis myself for so long. Like, it's so special to be working on your data." And as a grad student, I remember thinking, it doesn't really feel like that. But now I kind of get it a bit more. And I think I'm glad that I get it a bit more, because I still do it for certain projects. And I can feel that, like, how sacred it is in a way to be invited into someone's reality, experience in life, and to be able to actually get a glimpse of that and in a way translate or showcase it to the world, like to everyone that is outside of that encounter. I'm not trying to be romantic, but I am kind of like romanticizing the event in itself, because I do think that if you also can shift that perspective of how special it is, you can be really inspirational to your team and support people in a way that will reflect in the results and in the project flow overall. So this is it for today. I hope you have a wonderful day. If you have any questions after I am done, I am around. As I told you, had a kind of like a really crazy morning, so I'm not going to stay much longer live. I see some of you are here, but I will pop in again after I get a break, and I will come back. And if you have any questions, I'll be happy to answer them in the comments. And another plugin, we are really getting ready to open enrollment for Qualitative Research Blueprint. It's coming up very soon. We'll have registration opening on March 9th, and class starts on March 22nd. We'll have so much good bonus content as well. We'll talk about teamworks. Dr. Maria Mayen, my former supervisor and a book author, will be coming to talk about mentoring and working in teams. We will have a session that will be a longer session than it was for the first group, that is called Embodying More Than You Think, the qualitative researcher's body and what it tells you. And we'll also be talking about using social media advertisement, so that includes Facebook and Instagram, to recruit participants to qualitative research projects. So there's a lot of good stuff coming, and it will be such a good course. And the way I structured was thinking about more. We start on March 22nd, hopefully to give a lot of you time to finish marking your assignments, like finishing your term. And the heavy load of the course will come more in April, and we wrap up by the first week of May. And that will be it, and it will be really good. So I hope you consider joining, and if you're interested, join the waitlist. It's available on our website. And with that, you will be getting an email from us as a reminder in the beginning of March. and we'll have some special bonus for those of you who are on the wait list. So take good care and have a wonderful week. Oh, sorry, I was said goodbye, but I see a question, so I will take. I'm just reading the question. Hi, Mariana. I'm reading your question. How specific would you guide someone who is working with you so that they don't fall into the reduction? Go through it multiple times, for example, have them put it. Yes, I think you answered your question. That's exactly what I do. When I go, so you have a semi-structured interview guide. I usually encourage them to not look at it, not have those questions in front of them, and really work with the transcript for what it means, like for that unit. And it's absolutely normal that the codes and the categories that will come out of that initial like coding one transcript will very much mimic a semi-structured interview guide. But even the words and how you call the codes or the categories or the themes, depending on how you're analyzing the data, will be unique and open to more exploration if you're able to leave aside that document. And it doesn't mean that it won't come in later on in the analysis. Maybe as you're wrapping up, as you have analyzed a few, and when I say a few, it depends on how many interviews. Like for projects that have like 10, maybe you will be looking at those questions and trying to make sense of how you're going to present the data after you have analyzed 5 transcripts. For projects that have 20, 25 interviews, that might come later. But I always encourage the students that I work with to leave their interview guide aside. And it's almost like try to forget it a bit more and just work with the piece of paper or the screen, the transcript, whatever you're doing, with what is in front of you, and read it with an open mind. And it's one of those things, like you understand that you're influenced by your semi-structured interview, you understand you have a research question, you're investigating certain things, but you're also made aware and you bring to that level of consciousness that your approach is to be attentive to what participants are saying and keeping an open mind to what you didn't expect. And I think if you are working with someone, if you have someone to both check on you or for you to check on someone, you will be able to catch that. I have been caught in the act by people in my team in the past because I was trying to push nutrition and dietetics where it wasn't there. And people usually, if they know the data, if they have sat in one interview or read transcripts, whether you're being that person for someone or someone is being that person for you, they might be really aware and able to ask questions that will kind of bring you back to whether you're listening and paying attention to nuances versus being really stuck in that semi-structured interview guide. So I hope that helps. But you are in a sense, you are exactly right about what you said. It's more so practicing and doing that constantly check with yourself and with those that are involved in the project. Yeah? Okay, so now I'm going to check out. Yes, yeah, you're welcome. Have a wonderful day and I'll see you soon.